Again, thank you all for being here. It is now my pleasure and honor to introduce our distinguished guest speaker, Chaplain Philip Ridley. Philip Ridley is the Director of Spiritual Care and Chaplaincy at Suburban Hospital, Johns Hopkins Medicine. He is a native of Asheville, North Carolina, and served in the Navy for 29 years, 17 of which were spent as a Navy chaplain. He has a Doctor of Ministry degree from Bethel University with an emphasis on congregational and pastoral care and a Master's of Christian Education degree from Mid-America Baptist Theological Seminary. He completed a clinical pastoral education residency at the original Walter Reed Army Medical Center in Washington, D.C. He is an active member of the Association of Professional Chaplains. In his present role, he supervises the spiritual care team consisting of 4 staff chaplains and 10 volunteers who provide religious accommodation, pastoral care, and support to patients, their families, and 1,800 hospital staff. Furthermore, he delivers ethical and moral support to the palliative care, ethics, and internal review board teams. Additionally, he provides spiritual support and advisement to Suburban's diversity, health, equity, and inclusion, resiliency and stressful events, Veterans Employee Resource Group Committees, and the Sibley Memorial Hospital's Chaplaincy Services Committee. During Chaplain Ridley's military career, he deployed 3 times, once to Iraq, and spent 3 years at the National Naval Medical Center, providing spiritual support and counsel to critically wounded and ill active duty service members, veterans, their families, and staff. He supported critical care, trauma, med-surg, pediatrics, ICU, and oncology units. Chaplain Ridley and his wife Ginger have been married for 42 years. They have 2 adult daughters, Candace and Jocelyn, and 4 grandchildren. Today, he will draw upon his expertise in spiritual care and provide valuable insights into how you, as a community member, can cultivate resilience amidst the challenges of living with a chronic illness. Without further ado, I am honored to present Chaplain Philip Ridley.
Good afternoon, everyone. Thank you for that wonderful introduction, and thank you for this opportunity to share. So, continuing just a little bit about myself, I wanted to share that while growing up in Asheville, North Carolina, I began my spiritual journey as a member of a Presbyterian church. So, throughout my childhood, I attended a Presbyterian church. And then as I went off to college, I migrated over and started attending Baptist churches. And I eventually became a Baptist member of a Baptist church as an adult. As a chaplain, I have served in the Navy for 17 years, and I've served here at Suburban Hospital for 5 years. So with that said, I've learned one thing from being a Navy chaplain, and that is not to false advertise, meaning that when we do events in the Navy, we will always tell people exactly what we're doing so they don't feel like they was tricked or that they're attending something that they did not want to attend or was coerced in any manner. So as a Christian chaplain, this presentation will be Christian. It will I will be respectful of other faith groups. I have worked with Muslims, Jewish, and Buddhists, so I'm very respectful of our commonalities as well as those differences. And I want to be as collegial as possible. But I do want you to know that this will probably be more Christian than it will be generic, or as for some, spirituality does not mean religion. And as we go through this presentation, we will see what spirituality means as well as what religion means. So I want to make sure that I am sharing my screen and that you can see my slides.
Yes, Chaplain, that's confirmed. We can see your title slide.
Okay. So chronic illness and resiliency, navigating a journey with strength and hope. Okay, that's different. So my objectives today will be that participants will understand how spirituality and religion applies to their lives. Participants will be able to define spiritual resilience, and participants will be able to assess their current spiritual condition. Participants will learn how to navigate from their present spiritual condition to their desired condition. So first, what is spirituality? Spirituality is internal, is very personal, is unseen by others, whereas religion is more outward, it's organized, it's usually a community of like-minded believers. And I always like to share that religion usually has some type of religious leader or some type of clergy person that teaches the ways of that religion, teaches the standard based on their sacred document. They also teach how to pray, how to connect, how to meditate, their morality, right and wrong. So that teacher and that community reinforce what is taught in the church, synagogue, or mosque. Spirituality is a connection. Spirituality is a connection, generally speaking, with one's innermost being. It is also a connection with the universe or with a deity. So that connection is similar in both cases. Religion, the connection is more with the deity and with the body. And that's the church body, that is, not the personal body. Spirituality, while it's internal, it's personal. It gives you that sense of being, belonging, peace, self-awareness on the spirituality side. The connection with the deity, it offers the prayer, worship, and other attributes of that faith group. Spirituality is very informal and non-traditional. Many times a person can be having a spiritual moment and you wouldn't know it because they're just sitting quietly. Or they could be out in nature and experiencing spirituality. They could be anywhere and you wouldn't know it because it is very informal and non-traditional. Whereas religion, there are set practices or dogmas that people participate in. Spiritual resilience. Spiritual resilience, of course, spirituality and resilience put together, but it's the ability to bounce back. The American Association of Psychologists, APA, say that resilience is a process, an outcome of successfully adapting to a difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external demands. So that's a mouthful. But our goal today is how do we bring our spirituality, our internal and personal faith walk, as well as our outward and organized community or religious walk and morals, those connections of being and belonging, peace, self, prayer, worship, all these factors can go into how do we bounce back? How do we overcome adversity and challenges of life? Another attribute to resilience is that it's a characteristic. Many people would associate resilience with a trait, and meaning that it's something innate within you that you have this ability to bounce back or overcome. Whereas a characteristic can be cultivated, it can be developed, and it can be enhanced. So you don't necessarily have it as a trait to where you just have something that you can bounce back while other people might not have that trait. We all have the capability of increasing the characteristic of resilience. So I did some research just to support my thoughts about spiritual resilience as well as spirituality and religion. And in Australia, Ms. Utini and others, they came up with research where they worked with people who had chronic kidney disease or chronic cardiovascular disease, and they interviewed them and spent time with them, and they came up with the fact that spirituality does make a difference, and that spirituality does enhance one's capability of dealing with chronic illness. And the flow chart that you see in front of you has the role of spirituality in chronic condition management, and the four columns under that are different things that comes from a person's spirituality. The coping, being able to deal with stress. Another aspect of spirituality is being able to regain control. Many times when we are dealing with chronic illnesses, we feel like life is taking over, that we have no control, no autonomy. So dealing with the stress and having control over our lives can come through spiritual means. And those spiritual means are generally the practice of meditation, prayer, scripture. Another aspect that comes from spirituality that helps us with chronic illness and resiliency is the support that we receive, that sense of peace and community. Many times, the sense of place and community, um, it comes from attending church. It comes from worship services, but it also comes from the fellowship beyond the worship services. Things like working together, serving your community, caring for one another, different outreach programs, prayer and Bible study moments, all these different activities that go on through the church or through one's inner relationship and their time of spirituality. These things give you that sense of support through your community, and you have that individual autonomy. The belief in God will allow many to actually shift the responsibility of the illness over to God, who is sovereign. So that belief in God allows people to have power and allows them to be able to endure when you have the ups and downs of your medication is working for a little while and then you have a setback or something else goes on. So that up and down of just being in the medical system, that belief in God gives you that sense of power that somebody else is in control, not you, that you can release the feelings that you have. Another aspect of spirituality and coping with chronic illness is being able to accept. Um, those with a high sense of spirituality, those with that religious connection, they are able to make meaning of the situation and are able to let go of the stress, of the responsibility, the way of life. So they gain strength and meaning from their spirituality and their religious beliefs. And then finally, we have the healing aspect, and that's a psychological and an emotional healing aspect. The positive energy that people gain from their sense of community, having people that are praying with them or walking through this journey with them that are non-medical, those people can reinforce that positive attitude and help you to deal with what's you're encountering. So those emotional and psychological moments or feelings that you encounter, those things can be overcome and give you that sense of healing, whether the illness is gone or not, but you have the peace that you will overcome. Then, of course, you have the physical and that sense of recovery and increased self-worth. So many times, your spirituality, your faith, those things can affect your physical well-being and your physical person as a whole. So as you go down, those four columns will kind of flow into this health and subjective well-being. Increased sense of well-being, though that is just being aware of what's going on. and the well-being of being able to start doing your daily activities of living, to be able to navigate, move around, and to go and have that sense of control. So the influence on treatment and condition proceed and or clinical improvement gives you a greater resilience. And that's what the study gave us from Australia. I also saw another study that gave the similar support, but this study was based in the United States, in North Carolina, and same technique of interviewing people, doing surveys. They did group sessions, and they came away with the same information that coping and support, acceptance and healing were increased based on one spirituality. So the next aspect that we want to talk about is the self-assessment. How do we assess where we are from a spirituality point of view? We can look at our physical, our spiritual, our social, our relationships, and emotional. How are we responding to the ups and downs of life? How are we responding to situations that give us joy or anger or fear? And of course, our mental. Are we able to stay focused? Are we able to be creative? Are we able to think through the process and communicate things cognitively? So if you look at each of these areas, physical, spiritual, social, emotional, mental, you can kind of evaluate yourself and say, on a scale of 1 to 5 or on a scale of 1 to 10, my physicalness is at a blank based on my mobility or my lack of mobility, my ability to sleep, my ability to do various daily activities of living. So you can assess, where am I on the physical, able to move around or not move around, able to sleep, able to eat, able to care for myself, or do I need help? The spiritual aspect, am I at peace? Do I have that faith? Do I have that support from my community of faith? How are my relationships going on my social outlets? Am I connected to someone beyond my medical team? Am I connected with family members or friends? And of course, the emotional. Am I riding a roller coaster going up and down with my medication? Am I riding a roller coaster with regards to my emotions, or am I fairly stable? So you can rate these. And then, of course, mental. How is my cognitive ability? How am I thinking? Are my thoughts positive? Ranking those 5 areas and then periodically reviewing back. Okay, last month I was at a 5 with my physical. I was at a 7 with my spiritual. My relationships was good. My emotions are pretty good and mental is pretty good. So I'm staying in my high 20s, low 30s when you look at the various scores. So those are kind of ways of judging what's going on, how am I feeling. I also like Maslow's hierarchy of needs, because when you look at your biological and physiological needs, those are just what it takes to live. And then you move up the pyramid to your safety needs. Safety needs are, am I physically safe? Is my body physically safe? Am I employed, able to care for myself? Once you get those lower levels met, you can start moving up to love and belongingness. And love and belongingness, that's an area where now you're able to not only build some confidence because your biological and safety needs are met, but now you're able to actually start thinking about things like my spirituality, my connectedness with other people. Then as you continue to move up the high Maslow's pyramid, you start seeing your esteem needs. Those are the things that really build your confidence. What do you need to be uniquely you? And going further up the pyramid, you self-actualize. Are you reaching your goals? but you have to have the lower two levels built and solid before you can have a sense of love and belongingness. So those are just two ways of just mentally assessing where am I in this journey? Where am I when I'm dealing with chronic illness? Now, the application based on the research from those two research things that articles that I was sharing with you. Um, the big takeaway was connection, having that support group, being connected with yourself or with a higher power. And then if you are connected with yourself or with your higher power, with God, um, you can start applying some of the religious side of the house, which is your spirituality, your prayers, your scripture readings, or whatever your faith documents are. And then as you read those, you can start looking at the narratives that you pick out from various scripture readings. The unique thing about sacred documents, the Bible in particular, is that there is a narrative, there is a person in one of those um, sections of the Bible, one of those books of the Bible that relates to who you are. And as you look at that person and how they survive or how they overcome, you can apply their life to your life, which is why I use the word narrative instead of stories. So many times we talk about biblical stories and it almost sounds like fiction. But when you talk about a narrative, this is something that's documented that is true. Again, from your scripture readings, you can get promises and assurances. And of course, the connection and the community that comes from your spiritual as well as your religious. I'm going to go back one slide and also share a couple of stories that help just as examples. From the scripture, you have Hezekiah's prayer in 2 Kings chapter 20, verses 1 through 6. Hezekiah was diagnosed with a terminal illness. And when he received that diagnosis of a terminal illness, he prayed and asked to be spared. And he was actually given 15 more years. So through his prayer and his focus, he was able to gain more years in his life. Another one in Mark chapter 5, verses 20 to 24, is the synagogue leader. His daughter was sick and was dying. He went to Christ and he asked him to help heal his daughter. As he was en route to heal the synagogue leader's daughter, another young lady reached out and touched him. By touching the hem of his garment, she was able to be cured of 12 years of what they call an issue with blood, so that she was cured. And he addressed her and he said, "Your faith has healed you." So by seeking, she was able to be healed. Christ continued on to the synagogue leader's house, and there he actually kicked people out of the house, spent time with the parents, and he asked her to get up out of bed. So he healed her. So those are some of the physical miracles in the Bibles that can still happen. There's also some emotional things that happen or can be healed. Um, Anxiety. In Proverbs 12 and 25, it discusses how a good word of encouragement will remove anxiety. In Philippians 4 and 6, it discusses how when you focus on the positive things, the negative will be removed. So these are just various scriptures that can give a person encouragement, that can give them hope, alongside with the community of support that you get. So in summary, spirituality is a key contributor to navigating one's journey through chronic illness. Spirituality provides connections, connections with yourself, with your inner being, connections with a faith community that will give you support, that will give you love, and that will also provide you with the prayer and the religious support that you need. Through these connections, you also gain hope. Hope is that assurance of something that you can't see, but it's also an assurance that things will get better and that purpose in your life will be achieved. And from that, you gain well being, a sense of self, a sense of stability, a sense of peace. That well being will sustain you. So now I'm going to open up for questions for those that have any questions, and I'm going to stop sharing.
Thank you, Chaplain Ruby. We'll now open the Q&A session to address questions from today's attendees.
Am I still sharing?
Yes.
Okay. There we go.
Our first question, what are some simple things people can do every day to stay strong emotionally?
Well, depending on your physicalness and your capability to move, being outside and connected to nature is a great place to start, weather permitting. And once you are outside, having that moment of silence. Many times when we think of spirituality, we do think of moments of mindfulness where people can focus on their breathing, they can meditate, but you can also take it a step further, and that can be your quiet time for reading scripture, for prayer. So, thus, one of the most simplest things is just trying to find a place, whether it's inside or outside, to where you can have that quiet time to yourself before you get into the daily routine.
So next is not an actual question, but it's a comment from Cheryl.
Hmm.
She says, "Oh, well, my family does not understand my resilience. I am disabled and caring for my 89-year-old mom from traveling back and forth from Maryland to Philadelphia every 2 weeks with over 40 plus family not willing to participate." Chaplain, really, what would you advise our attendee today in regards to this situation?
It's a tough situation because it sounds like Carol is not feeling like she's totally supported or part of a team. But when we do the right thing and we're operating out of the goodness of our heart based on our faith, in the long run, you'll either win others over and they'll start helping out, or you will be that person that your loved one who is sick and needing support will grow to depend on, and you'll be that presence of God. You'll be that presence that shows his compassion. And many times others will come around later on, but it doesn't make you feel good that you have to shoulder the burden by yourself. So you will have to actually incorporate spirituality and spiritual resilience into your own life so that you won't look at what the others are not doing. And that's hard, but it can be done because your faith can overcome the emotions and the frustrations that come from looking around at what people can do that are not doing, or what people should be doing to help out their loved one. I hope that helped, Carol.
It was for Cheryl.
Cheryl. Cheryl, I'm sorry.
Our next question from the audience is, how can someone stay connected to their faith, even if they can't attend services or gatherings?
That is one of the best things about being spiritual and religious is the church, synagogue, or mosque, your place of worship and attendance, is a great place to go for the connection, for the energy of other people, and for the encouragement and even the teachings that goes on there. But your faith resides in you. Your creator, God has just given you his spirit. So if you cannot physically make it to your place of worship, you can still worship at home. You can still worship through prayer, meditation, reading. Um, in this society, you can also worship online. Many churches will have like Facebook online to where they can stream. Might not be the best camera angles or the best, it won't be a TV show, but you can feel what's going on and be present by watching the Sunday or your worship service. But God dwells within you, so you don't have to necessarily go to the building in order to worship.
That's great advice, Chaplain. Our next question is, are there ways to find joy or peace even while being sick for a long time?
Yes. And the joy and the peace comes from within you. Even though you're sick and you're not feeling comfortable, and if those periods of illness involve hospital stays, you're not in your home, you're not in a comfortable place, but the God that's within you, his spirit dwells in you. So you can find peace by emotionally and mentally setting aside time and connecting. If you don't have the mobility of your limbs, um, somebody can turn an iPod on or a phone and actually provide music, or they can let you listen to previous sermons. So there's ways to where you can listen if you can't read or you can't um, navigate different devices, but there are ways that you can still be ill and still have a sense of peace through your spiritual and the being that dwells within you.
Next question. What are some simple things people can do every day to stay strong emotionally?
So the simple thing is, it's going to sound crazy, but you need to focus on yourself. When you focus on yourself and your spirituality and your faith, then the external things, the madness, those things that push your buttons, you're in more control. That's not going to push your button. You're understanding that big picture, this is going on for this reason, so I don't have to get as upset. Whereas when you're not in that spiritual place and you're not centered, then when somebody pushes your button, you just lash back. But as you gain control of yourself and your behavior, one of the things I always think about is that your thoughts drive your feelings and your feelings drive your behavior. So the way you think about what's going on in your life on a daily basis will drive your behavior, which is your emotions, or your feelings, which drive your behavior, your response. And you can't control other people, but you can control yourself. These are some great questions.
Yes, they are. We need to keep them coming. Our next question is, how do you keep relationships strong when illness affects your mood or energy?
The relationships, prayerfully, people will come to you because your energy is low. You can't get out and about. So prayerfully, you'll have a way where people can come visit you. And that's one of the things that the faith community is really good about, as well as family and friends. When they care about you, they will find a time to come and visit you where you are. And if your attitude or if your energy is still low, they can understand why it's low and they can still support you in their presence. So having an open door or having somebody around you that can open the door and let people in, far as your home or wherever you're residing, That's something that will allow you to have those relationships in spite of your highs and your lows. But just be aware that the community will rally around you. And the good thing about being a part of a community of faith or a family is they might not come visit you every day, but they will come and visit you throughout the week to where you do have visitation. And you can always, if you're able, um, you can email, you can have phone calls. So you can initiate some things if you're able to with phones, computers, emails, text messages. Those ways that our younger people are doing do help maintain relationships. I'm on Facebook now mainly to stay in touch with my family because when I was in the military, we was always in different locations. So social media does help. It's a little bit awkward as you get older. My mom, she has arthritis. So even touching the screen of a iPad or iPhone is not as easy for her to navigate. But when we can, we actually come visit or we actually work with trying to make it as easy as possible so she can get on social media and be online with us. It's nothing like a FaceTime call to cheer a person up when you can't get there.
Well, Chaplain, as a veteran myself, I spent many a days and months away from my family, whether that was deployed to Iraq, Afghanistan, or just being overseas. So I definitely can relate to that, and I appreciate you sharing that with the audience. Our
Mm.
next question is, what does resilience really mean living with a chronic illness?
Well, we gave you the textbook message definition of resilience about being able to bounce back. But when you are chronically ill and you're not feeling well, your ability to be present each and every day might be the overcoming adversity, the bounce back. So it might not mean that you're getting better far as bouncing back, but your ability each day to wake up, to be present, to be able to communicate in some form or fashion, those are the things that are making you resilient because you're still present and you're overcoming adversity by definition. So it can be done. It doesn't feel like it, but it can be done to where you are present each and every day. And I'll add alert, present and alert.
What advice do you have for someone who feels their illness has shaken their faith or beliefs? Like, what do you say to a community member, or maybe it's a friend or a family member or a neighbor that's really feeling down because of either their illness or somebody in his family? What kind of advice would you give that person as it relates to their faith?
First, I will always let them know that when you're struggling with your faith, that God still loves you. When you're struggling with your faith, it's okay because it is a sign that you are a person of faith, but you're having doubts. There's a passage of scripture that has a man who child is sick, different scenario. He's sick, and he comes in the presence of Christ and asks for help. And Christ asked him, "Do you believe?" And the man says, "Help my unbelief." So sometimes we're in situations to where our faith can grow. So while we're looking at the presence and we're looking at our circumstances, we can grow spiritually in the midst of adversity. And sometimes adversity is the invitation for us to reach back out. We can get very comfortable and get into routines where we're not connected as much. But then when things are going become challenging, then we are much more open to reaching out and praying and meditating on a regular basis. So I'll always assure people that God still loves them, even though they're going through a bad time and even though they're having doubts. And the doubts, as they wrestle with them, can lead to an increased, improved straight faith if they don't faint or don't give up. So just keep on wrestling, and you'll eventually get to a point to where you start understanding. There's an old expression that says hindsight is 2020. So when you start looking back at where you've been or looking over what you've overcome, you start realizing, I really was being supported and being kept. It wasn't just all negative. But when you're going through, all you see is the present, what's going on right now, this day. And sometimes we forget what we've overcome just to get to this day.
The next is actually a comment and not a question. It was submitted by Leslie. Leslie said, in addition to faith, there are many support groups that can help Cheryl that deal with specific diseases, family issues, etc. Chaplain, would you care to elaborate? Like, is there any support groups that you can think of? Besides, church always, obviously it's a support group within itself, but besides attending church, can you name any different types of support groups that you're familiar with, or maybe that you would recommend to anyone, or just any kind of suggestions?
Well, I'm gonna start with one big one, and that's the Washington Metro Oasis. That is a community of learners, a community of support. So, and I also know many are probably from there because of the advertisement, but Washington Metro Oasis is a group that's helping people to learn about illnesses, opportunities, to be creative. From there, I would go to the YMCA or the YWCA as another place. My mother, who's 94 years old, her place is going to the Senior Citizens Community Center in North Carolina. So she likes to go there because she can do crafting, she can get exposure, she can be around friends, and she might even pick up a lunch here and there. So those are the ones I can think of offhand of various areas in our neighborhoods that's kind of readily available. The Y, senior citizens, or um, trying to think of something else that's not really church related, but still has that positive energy that helps people. Um, there's a lot of community centers and senior neighborhoods are becoming popular now to where you have your own living community of say 50 plus, and they have reinforcement recreational activities, the spiritual activities. They have everything in one community, so you don't have to travel as much.
Wow, Chaplain, that was really great. You really went into detail about some different support groups and some different resources. So I hope everyone found those that you mentioned valuable. Our next question is, excuse me. The next question is, hello, my elderly cousin isn't religious and doesn't follow faith. What could he do to get through his illnesses, recently deceased spouse, and loneliness?
Um, that's one thing about spirituality. Um, you don't have to be a person of a particular faith, but you do have to have a connection with yourself. And that connection with self, with nature, those are things that can help your cousin. But when he's dealing with loss and loneliness, it will be good that you, as a cousin, and hopefully other family members, will just keep reaching out to him. And as you reach out to your cousin, they will start seeing that they are experiencing some love beyond the loss of their loved one. They're experiencing love and community beyond what would be prescribed as a church or community of faith. So you can receive that same love and support from family members, and that love and support will grow over time into where he could become a spiritual person and still not a religious person. So continue to reach out and support your cousin and encourage other family members to do the same.
I really love this next question. Have you noticed anything that people with strong inner strength tend to have in common?
Um, Working in the hospital, those people with strong religious faith and convictions, they generally are very positive. They're generally very cordial. And while they might be experiencing pain, they might be experiencing poor diagnosis, they actually encourage myself and the staff here. So that conviction radiates in positivity. So that's one thing that I noticed. And I also noticed that those with the stronger convictions, um, they usually don't stay in the hospital long. In many cases, that positive conviction, that faith will allow them to go to their home or to rehab, someplace where they can get more personalized attention. It doesn't mean that life is getting better, but it just means they're not staying in the hospital as long.
What are some small steps that someone can take to build inner strength over time?
Um, I would find some type of devotional based on what you believe and what you want. Another word that people use nowadays is a book of affirmations. So spending 5 minutes a day reading that affirmation or reading a devotional can be a great simple step towards increasing your faith, increasing your spirituality, and having that moment of solace. If you are mobile and if you have the capability, um, exercise, walking. There are patients and loved ones in our hospital that I see walking up and down the hallways. They're not going anywhere. They're not on a treadmill, but they're just walking up and down the hallways just to move, just to have the circulation. So that's simple things if you're able to just stand up, don't sit down, take a couple of steps, and when you get tired, definitely get some rest. But, reading a little bit here and there, taking some steps and getting a little bit of exercise, and then I would finish off with listening to something positive. If you're into music, listen to positive music. If you're into podcasts or radio, TV, just listen to something that can help teach you or build up your um, positive energy or your spirituality. So those are some simple steps.
Falcon, so you work here within a hospital setting.
Mhm.
How can doctors and nurses support patients' emotional and spiritual well-being? So your response could either be something that you witness doctors and nurses or hospital staff actually do to support a patient's emotional and spiritual well-being, or if not, you haven't personally witnessed it. Like, what would be your advice?
Um, Definitely the nurses and many of the doctors. It's a simple thing like just touch. You touch a patient's arm, touch their hand while you're talking to them. That is a sign of connection. It's a sign of you care. So that's the simple thing. I notice more with the nurses because they spend probably 12 hours, six of that probably with one patient, and then they have another patient. The nurses will talk to their patients. They will get to know their patients. Many of my calls or referrals come from nurses because they know the patient. They've talked to and had conversations with. They've touched them. They've listened to them, and they know when patients need, the spiritual support or need prayer from a chaplain. So the nurses are very engaged. Most of our doctors are just as engaged because I get referrals from them as well. So people are realizing that there is a holistic person. There's the physical, biological person that needs the treatment, but they also realize that there's a person, a soul, spiritual being that's within the body. And so they make notes of that, from simple things like where do they live, family dynamics. The genealogy that they get is not always about the history of illness, but it's like, what kind of support network do you have? What can we plug you into? We also have social workers, case management people who help people transition from our hospital to the next phase of their not transition plan, but their I don't want to say prescription, but they have a healthcare plan that they are going to execute to get a person back up. So these case managers and social workers also are in the patient's room, and they're listening to the patient or the family and supporting them by making those connections. So our staff is very engaged. That's the good thing about not being at a large hospital. We're what they call a community hospital. So our staff is a little bit slower and more engaged as compared to your huge medical centers.
Captain, what would you say, or what do you say to someone who feels like their illness is a punishment? I.e., for example, someone recently was diagnosed with lung cancer, and they may view that as being a punishment from, God, or, what, based on their spirituality, they may feel like they're being punished for some of the decisions they made, in life. What would you recommend to our community members if they knew someone like that, or if they were feeling like that themselves, or had a family member or a loved one?
Um, I usually ask patients or people that feel like that to kind of name the characteristics of God. And when you start thinking about his characteristics, you can have the characteristic of love and compassion usually comes up. And if you're a compassionate God and a loving God, then you will allow things to come into people's lives, but it's not for punishment. It's not for um, revenge or anything like that. It's just over the course of time, we live a good life, and then eventually we all get the rewards of our life, which is to be in his presence. So the sickness is not a punishment. It might just be one of those things that happens to a person to help them transition to the next phase of life. So I never want to let them think that God is just really punishing somebody, because I don't think he punishes. He's a God of grace. So even when we do make mistakes, we don't always get what the mistake deserves by law or by his law. So I usually try to remind them that the characteristics of God are not vindictive to where he's going to punish you. We do go through life, and many things happen to each of us that are unexpected or illnesses, but they're not to hurt us or not to punish us, but to help us get to the next phase. Some illnesses are just to show other people that faith will get you through, and faith can help you to reach another level. So it's not always about death and dying, but it's just about reflecting his grace or reflecting the fact that he's allowed you to experience something so that you can grow.
Thank you for that, Chaplain. I'm pretty sure the audience really enjoyed and appreciate that response. We have a couple more comments um, as we only have a few minutes remaining. So this comment is from Cheryl, and if you remember, Cheryl was the community member that said she was experiencing resilience because she was, traveling back and forth to Philadelphia, taking care of her 89-year-old mother that was, sick or going through some health issues. She had
Mhm.
another comment. I'm a member of the Oasis organization. So you remember you recommended Washington Metro Oasis. So Cheryl is actually a member, which is great.
Mhm.
Cheryl says, I'm a member of the Oasis organization and positive aging. My mom has early onset dementia, and both spiritual and community organizations have been an asset to me, especially sessions like this. And she says, thank you.
Oh, well, thank you, Cheryl.
Thank you, Cheryl.
And I'm definitely sorry for calling you Carol.
Let's see. This is a comment from an earlier question. The person didn't leave their name. I read the person's question, but they missed it. They had to step away, so they wanted me to repeat the answer. And that question was, um, this is the one that this was the question that said, what could the cousin do? Like the cousin was doesn't believe in religion, doesn't follow
Mhm.
faith. What could he do to get through his illnesses, recently deceased spouse, and loneliness? You responded to it, but unfortunately, the community member had to step away, didn't hear it. So could you repeat that quickly? As we only have about 1 minute left.
Okay. I encouraged the family to rally around him, family and neighbors to rally around him. And by rallying around him, visiting him, supporting him, that will show God's love, His grace, His compassion, and that can help that person to embrace spirituality to a degree. They might not ever become a religious person, but they can be a spiritual person to where they are connecting with a higher power, they are connecting with nature, and they are growing in a sense of peace and awareness of who they are, that sense of being and belonging. So, neighbors, family, if you're reaching out and supporting that person, especially during the loss of a loved one, so many times when a loved one passes away or dies, after the funeral, everybody goes back to their normal life. But really and truly, after the funeral is when the people start to grieve and need family support the most. And he will appreciate that family support and visitation and outreach through phone calls or however. And they'll realize that they are loved and they're not as lonely as they thought.
Thank you, Chaplain, for taking the time to repeat your answer to that community member as they were unavailable at the time you originally responded to. So thank you for taking the time out to do that. Ladies and gentlemen, this concludes the Q&A session and today's webinar. On behalf of the Community Health and Wellness team at Suburban Hospital, we sincerely thank you for joining us and extend our deepest gratitude to Chaplain Ridley for sharing his expertise today. We hope the information provided has been valuable to each and every one of you. As a reminder, please take a few moments to complete the survey that will appear at the end of the webinar. Your feedback is greatly appreciated and helps us improve future programs. Thank you again and have a wonderful rest of your afternoon.